There's more in our faucets than just water. There's a whole world inside of our sinks, full of microbes and amoebas. Now, most of the time, these microbes are harmless. They're safe for us to drink, they're safe for us to breathe in. But sometimes, these microbes can pose a serious risk to our health. One of the harmful microbes in our water systems is Legionella pneumophila. Legionella is a bacteria that is found in natural environments, like lakes and ponds. But it thrives in water systems like industrial hot water systems and cooling towers, hot tubs, showers, fountains, and even faucets. Within these systems, Legionella infects other microbes, like amoebas or ciliates, but can cause disease in humans when it gets inside of our lungs. This disease is called Legionnaire's disease, a type of severe pneumonia. As a form of pneumonia, Legionnaire's disease causes shortness of breath, dry cough, a fever of up to 40 degrees Celsius, a headache, and muscle aches. This is a severe illness, and most patients are hospitalized. Legionnaire's disease has a 10% mortality rate. But, lucky for us, Legionnaire's disease can be treated with antibiotics. These are typically given with an IV. In extremely severe cases, patients may need to be intubated or given extra oxygen. Legionella can also cause a milder illness called Pontiac fever. Pontiac fever has more flu-like symptoms, like coughing, fever, aches, and chills. And patients with Pontiac fever do not need to be hospitalized.
Legionella is not transmissible from person to person. It can only be transmitted through water. For example, when you open your shower head, there's water aerosols that travel through the air. These aerosols can carry Legionella into people's lungs, and that's how people get infected with Legionella.
You are most at risk of contracting Legionnaire's disease if you are over the age of 50, if you are immunocompromised or have a pre-existing medical condition, if you are a smoker or have smoked in the past, if you've recently received care at a healthcare facility like a hospital, if you've recently stayed in a hotel, or if you frequently enjoy using hot tubs.
You might be thinking, what can I do to prevent Legionella infection? For example, if you have a hot tub or a pool, make sure that you have it clean, that the chlorine concentration is adequate, and the pH level is correct. Also, if you leave your house or your apartment for a long period of time, when you get back, make sure to flush your taps and shower heads with hot water.
It's not just your job to prevent the spread of Legionnaire's disease. Since many Legionnaire's disease outbreaks are caused by industrial water systems, it's up to the government to set rules and regulations to control Legionella.
So at the federal level, what the federal level is doing, they are essentially, Legionella is a notifiable disease. So any cases in Canada need to be notified to Public Health Agencies Canada, and that way they can keep track of the number of cases in a year, right? The prevalence of Legionnaire's disease every year, see if it's increasing, it's decreasing, and stuff like that. At the provincial level, then province and territories are responsible for building codes. So at that level, they can, adopt regulations to force operators of water system, cooling towers, things like that, to monitor the level of Legionella in their systems, and also dictate what kind of actions needs to be taken when thresholds are reached, right? And then at the city level, then cities are also allowed to enact regulation, how buildings are operated, how they are maintained and stuff like that.
Sometimes the existing regulations just aren't enough. You can drive change in Legionella control policies by pressuring governments to improve their policies surrounding Legionella control and water infrastructure management. You can do this by contacting your MP, your provincial representative, or your alderman. Now, most people haven't heard of Legionnaire's disease, so you can be a voice for change and warn others about potential risks and ways that they can prevent this disease. Cases of Legionnaire's disease are in the rise in Canada and worldwide. Governments, scientists, water system operators, and even you need to work together to control the spread of this disease, keeping Legionella out of our sinks and, more importantly, out of our lungs.